Hello everyone, welcome back to my channel, The Physio Vlogger. So in the last vlog or the learning session, we had seen about biomechanics of vertebral column, the part 1, the basics of vertebral column. In today's lecture, we'll be learning about the ligaments of vertebral column and also the brief kinetics and kinematics of vertebral column. So stay tuned for today's session. So in vertebral column there are 6 main ligaments and you should always remember them in a sequence so that you do not forget them in between. So the 6 main ligaments of the vertebral column are anterior longitudinal ligament, posterior longitudinal ligament, intertransverse ligaments, ligamentum flavum, interspinous ligament and supraspinous ligament. For students it is easier to remember with the help of a diagram. For example, suppose this is a cross-sectional area of the vertebral body. So the ligament which will lie anterior to the body is the anterior longitudinal ligament. The ligament which will lie in the posterior part is the posterior longitudinal ligament. The ligament which supports the neural arch is the ligamentum flavum. The supraspinous ligament connects the tips of every spinous process, that's the supraspinous ligament. Whenever we talk about ligaments, the main important points which should be remembered is the name of the ligaments, their location, their fibers and the function of the ligament. If you remember the basic structure of the ligaments, it becomes easier to remember it region wise because these ligaments are going to be present in every region. Just the specifications are going to change according to the region. For example, ligamentum flavum might be different in thoracic region and in lumbar region, but ligamentum flavum is going to be present in all the regions. So once you remember the basic ligaments and their properties, it becomes easier for the student to remember it region wise. So first we'll go with the anterior longitudinal ligament. Anterior longitudinal ligament and posterior longitudinal ligament, they are more or less similar, just it's different in the case that anterior longitudinal ligament moves from sacrum to second cervical vertebrae, while the posterior longitudinal ligament goes from C2 to sacrum. So it is present on the anterior and lateral surfaces, which is like this. It is here in the anterior as well as lateral surfaces, and posterior is in the posterior part of vertebral body. Now it has 2 layers. So every ligament might be having 2 layers, which is superficial fibers and deep fibers. Now why is that required? Because the ligaments have to hold these structures together. The ligaments need to be strong enough so that whenever your vertebral load increases, they do not buckle on themselves and do not damage the vertebral bodies and ultimately vertebral column. So the ligaments generally they have 2 layers, which is the superficial and deep fibers they blend with the fibers of annulus fibrosus and reinforce the anterolateral portion of the disc. Now how do you remember that which ligament is stretched in what position and what is the function? So it's simple. Always remember the location of the ligament. Based on the location, you can easily apply your common sense and think that if it is anterior longitudinal ligament, so whenever you go for flexion, it is going to get compressed, and whenever you do extension, it is going to get stretched because it is present anteriorly, and it will be reversed for posterior longitudinal ligament. The posterior longitudinal ligament will be compressed in extension and stretched in flexion. Okay, so this is about anterior longitudinal ligament and a brief about posterior longitudinal ligament. Third very important ligament is ligamentum flavum. Ligamentum flavum is thick, elastic in nature. And why is this elastic? What is the advantage of this elastic nature? We will see it later on. See, whenever the ligament is under constant this ligament is said to be under constant tension even when the spine is neutral, as it has elastic nature, and it connects lamellae to lamellae from C2 to sacrum. So always, if you want to remember the ligaments, just draw a small diagram at the side, make the ligaments positions, just make it out small diagram, and it will be very easier for to remember the locations of the ligaments. Okay, so why is this elastic in nature? What is the advantage of this elastic nature? So it creates small but continuous compressive force on the disc. Now as it is elastic in nature, okay, so it will cause a constant compressive force on the disc. Raised pressure makes the disc stiffer, so it can provide better support to the spine. Now if these are your vertebral bodies and the disc are arranged in between, this ligament is going to cause a continuous compression on the sides. So what will happen? It will maintain the pressure in the disc, and the disc will become stiffer and it will not move out suddenly. Another advantage is this ligament will not buckle on itself. It is important property of a ligament to not buckle. See, whenever there are discs, for example, this is some vertebral bodies and the disc is in between. Sorry for the lighter diagrams because I didn't want to spoil my notes. So yeah, so this is suppose the vertebral body and the disc is in between, and the ligaments, they are the connecting structures which are present in between these ligaments, and in the connecting structures which are present between bodies and the disc. Now they should have and they should maintain their properties so that they do not collapse. If they collapse, what will happen? The stiffness or the pressure of the disc will no longer be maintained, and that will lead to alteration in the biomechanics. Okay, so this ligament will not buckle itself. If it buckles, it will compress the spinal cord, especially during the extension. So ligamentum flavum is very important in the sense that you should know that it has a elastic property. And why is that elastic property important? That should also be noted. Another ligament is the interspinous ligament, which connects the spinous processes of the adjacent vertebra. It resists flexion, but it may also resist end range extension. On the base of location, you can easily write down the function of that ligament. Another is the supraspinous ligament. It connects the tips of the spinous processes and it's stretched in flexion. The important thing in supraspinous ligament is it contains mechanoreceptors, and mechanoreceptors play important role in recruitment of spinal stabilizers as multifidus. Now what are mechanoreceptors? Mechanoreceptors, they are kind of receptors which will detect any kind of excessive movement. They are going to send signals to the brain that there is something wrong which is happening, and it plays an important role. See, whenever the load on the vertebral bodies and the spinous process increases, it will immediately try and transfer that force. That force will be transferred to the ligaments, and ligaments, they try and not collapse, but the ligaments are very smaller structures compared to the muscles. So what will this supraspinous ligament do? As soon as there will be a lot of pressure on the supraspinous ligament, it will send signals to the brain that now start recruiting the muscles. It is just not enough for the ligaments to work. So this is an important point in supraspinous ligament, that it contains mechanoreceptors, and these are important in recruitment of spinal stabilizers. Then you have intertransverse ligaments, which connects the transverse processes and compress during lateral bending. So this is the main important ligaments, the gist of the ligaments. In detail, every ligament should be written in exam according to its role in the region. Suppose in cervical region, the ALL would be different and the PLL would be different. The ALL continues in the cervical region as anterior atlanto-occipital and atlanto-axial ligament. The ligamentum flavum continues as the posterior atlanto-occipital and atlanto-axial ligament. So the specifications need to be remembered when writing according to the cervical region or the different regions. When the gist has to be explained, it can be explained with the diagram and naming the ligaments, their properties, their role in the biomechanics of spine. Next, what we'll be seeing is the kinetics and kinematics of the vertebral column. Kinematics. So kinematics is the motions which are available in vertebral column. So what are the motions which are available in the vertebral column? So they are flexion, extension, lateral flexion and rotation. Now these movements, they are generally performed together, and it is more or less performed in such a way that you cannot differentiate it completely. For example, flexion and extension can be differentiated completely, but there is movement like lateral flexion and rotation which are performed together. So there is a term which is known as coupling. So what do you mean by coupling? Coupling is the consistent association of one motion about an axis with another motion around different axes. So there are two different axes and two different movements are occurring at two different axes, and when they occur together, it is said to be the coupling motion. So this is an important terminology which you need to remember when writing about the kinematics of the vertebral column. So the movements available are flexion, extension, lateral flexion, rotation. Flexion, extension, they occur on different axes. Even lateral flexion and rotation occur in different axes, but these two movements are such movements, they might occur together, and it is difficult to differentiate these movements. Now it is very simple to remember flexion, extension, lateral flexion, rotation, and what changes occur in them once you remember all the structures and the basics which we had seen in the part 1. So in flexion, extension, what happens? So in flexion, suppose this is your vertebral column and this is the disc. Okay, so anteriorly when the vertebral body moves, that is said to be flexion. In vertebral flexion, what happens? Vertebral body of the above, which is the cranial, it tilts anteriorly, and the inferior facets of the vertebra, they slide upwardly. it causes separation of spinous process. Suppose here are the spinous processes, somewhere here is the spinous processes, so it will cause separation of the spinous processes and anteriorly tilting of the cranial vertebrae, and that will cause compression of the structures which are present anteriorly and distraction of the structures which are present posteriorly. So now this supraspinous and interspinous ligament tension resists the separation of spinous process. Also, what happens is whenever there is flexion, the anterior portion of annulus fibrosus is compressed, whereas the posterior portion gets stretched, and passive tension in the zygophysial joint capsules, ligamentum flavum, PLL, and spinal extensors, they all restrain the flexion. See, certain amount of flexion is important for the lumbar spine or thoracic spine or a whole vertebral column, but excessive flexion should not occur as it might damage the structures of the vertebral column. So they all are resisted by this PLL and spinal extensors and ligamentum flavum. Now when we talk about extensors, extension movement, what will happen is just the ulta of flexion. So there will be a posterior tilting of this superior vertebrae, and there will be passive tension in zygophysial joints, ALL, anterior fibers of annulus fibrosus, and all the structures which are anteriorly, they will be getting stretched and the posterior structures will get compressed. But it should be remembered for the fact that ALL is stronger than PLL, so it will resist more extension. The extension would be resisted more effectively because ALL will get stretched more. So this is flexion and extension. Now learning about lateral flexion and rotation. So what has to be remembered is lateral flexion is different in different regions. So what happens is in certain regions like lower thoracic and upper cervical, in these regions lateral flexion occurs with contralateral rotation, and in the regions like upper thoracic and lower cervical, there is lateral flexion with ipsilateral rotation. So what does actually happen in lateral flexion? The superior vertebrae, it laterally tilts and translates, and the intervertebral foramen is widened contralateral to the direction of lateral flexion. Suppose this is the side in which lateral flexion occurs, this side of the intervertebral foramen will get widened and this side it will get shortened or narrowed. Rotation is available in each spinal region, and this lateral flexion and rotation, they are generally the coupled movements. They generally occur together, and it depends, as we talked about in lower thoracic and upper cervical, when the lateral flexion is occurring suppose towards right, the rotation will be occurring towards the left. It is due to, why does this happen? Because of the orientation of facets, which we will learn according to the region wise, that what is the difference in cervical, thoracic, lumbar, sacral. But just to remember, this is the gist of the movements, the lateral flexion and rotation. So this all occurs because of the orientation of the facets and the placement of the vertebral bodies. So this is about the kinematics. In kinematics, you just need to remember the movements and the ligaments. What role does the ligaments and the surrounding structures play in that motion? That is how you will remember kinematics easily. Next, what we'll be seeing is kinetics. So what all are the forces which happen to occur in the vertebral column? So the forces which occur in the vertebral column are bending, shear, torsion, and axial compression. So what do you mean by axial compression? Axial compression is the force which acts to the long axis of the spine at right angle to disc. Suppose this is the disc. Any force which occurs at right angle to the disc is said to be axial compression. Now there is something very important to understand about nucleus here. See, nucleus pulposus, we had talked, it's like a jelly structure, and it acts like a ball of fluid which can be deformed by the compressive force. Now there is pressure exerted on this nucleus pulposus and your disc when there is loading which occurs from the upper part. So how does this loading, the weight gets transferred? That is important to understand. So let's go in depth in understanding this concept. So for understanding axial compression, we'll understand it with this diagram. Suppose this is your vertebral body, this is the disc, and this is another vertebral body. So axial compression is something, the force which is exerted 90 degrees to the disc. So whenever this happens, so in this disc you have something which is known as nucleus pulposus, and it is surrounded by this annulus fibrosus. Okay, and then you have vertebral end plates. So whenever there is axial compression, why does this nucleus pulposus does not move out suddenly. And why does this nucleus pulposus does not bulge out? The reason for this is that whenever there is increased loads on the vertebral body, it will transfer it to the disc, and disc has a property of absorption of forces. So disc is going to try and absorb these forces. But how is the disc going to absorb the forces? So as soon as the force is going to come to the disc, what will happen? It will go to nucleus pulposus. Nucleus pulposus will try and resist the force, but as it is a jelly like structure and it does not have much of collagen, what it will do, it will transfer the load to annulus fibrosus. And annulus fibrosus, it has more amount of collagen. Why it is required? Because it has to resist these forces in more proportion compared to nucleus pulposus. So as soon as the force will come, it will go to nucleus pulposus. Nucleus pulposus will initially try and resist it, but as it cannot be done alone by nucleus pulposus, it will transfer it to annulus fibrosus. Once it has reached to annulus fibrosus, there are two options. Annulus fibrosus can send it back to nucleus pulposus, and either it can send to the vertebral end plates. So both the things happens in this region, and that is how there is a maintenance of the equilibrium in this vertebral disc, intervertebral disc. So it is important to maintain the equilibrium of the intervertebral disc so that proper amount of pressure is maintained, and this pressure is important so that the biomechanics does not get altered. This is also something which is known as intrinsic equilibrium. So intrinsic equilibrium is maintained by this transfer of loads. For example, just remember, suppose you are holding 1 kg dumbbell in your right hand. You are told to hold it for suppose 24 hours. In 12 hours, you try and hold the 1 kg dumbbell, but now your muscles are getting fatigued. So what you will do, you will transfer the 1 kg dumbbell to your left hand, and then again after 12 hours you are going to give it to the right hand. So what will happen, you have the capacity to hold 1 kg load, but it may not be there for 24 hours, it may be there for only 12 hours. So what you are doing, you are just transferring the weight. Your both right and left hand have the capacity to hold for 1 kg weight, but not for 24 hours, but they still have the capacity for 12 hours. So what you do, you transfer the weight, you keep on transferring the weight, so it becomes easy for you to maintain and hold that weight. Similarly, this is what happens in your disc. So the pressure is created on this annulus fibrosus, and then it's transferred to the vertebral end plates, and from vertebral end plates it will go to superior and inferior vertebral bodies. Now the end plates, they are something which undergo least deformation, and they are generally the first to fail or fracture in high compressive loading, and discs are the last to fail. There is a fun fact for you all to remember. There is something which is known as PGs and water. In the wake up in the morning, what happens, you are little bit taller in the morning, and this is not a joke or something. What happens when you are in supine position or when you are in the non-weight bearing position, what happens, your disc, they are going to absorb water from the surrounding areas because it has proteoglycans, and the property of proteoglycans is to absorb water. So you are going to be little bit taller in the morning compared to the evening, because in the non-weight bearing position the disc have absorbed the water and your disc must have swelled up. That is why all the disc size is going to get increased little bit. So you are taller in the morning compared to the evening. So this was about axial compression. The best way to remember bending is as we used to remember the lateral flexion. That was the movement, this is the force. Whenever you have a spine, suppose this is your spine, when you lateral bend, so there are forces which occur on the spine. First one was the axial compression one, another one is your lateral bending. What happens is, you have to remember it that forward, in forward bending what happens, in extension, in posterior bending what happens, and in lateral bending what happens. Bending basically causes both compression as well as tension. In forward flexion, the anterior anterior structures, they are subjected to compression, and posterior structures are subjected to tension, and in extension it is vice versa. In lateral bending, the side to which the bending occurs, compression of the disc occurs, compression of the disc occurs, and the opposite side is stretched. Suppose you are bending towards right side, so this side your disc is going to get compressed and the opposite side it is going to get stretched. So this is what you have to understand about bending. Now there is another concept of creep. That what do you mean by creep? So if you have sustained loading to any structure in the body, what will happen, there is something which is known as creep. This is important to understand that what do you mean by creep. Creep occurs when the vertebral column is subjected to sustained loading. Suppose this is your stress strain curve. This is the stress and this is the deformation. When your vertebral body is given certain amount of force, first it will give the stress would be given, it will deform a bit and come back to its original position. As the stress levels they are going to get increased, there are less chances of it to come back to its original position. Ultimately there will be a point in which macro failure is going to occur. So if creep deformation of the tissue occurs within the toe region or the elastic region of stress strain curve, the structures will return back to their original dimension. If the deformation exceeds the elastic region, the vertebral structures may be at a risk of injury. So this is all what you have to be mentioned in the bending, that if bending forces are continuous, there will be a time when your vertebral bodies are going, when your vertebral structure and your column is going to get destroyed or it may break. The third force is torsion. Torsional forces are created during axial rotation. Whenever there is coupling motion and whenever there is rotation, the torsional forces are created. And annulus fibrosus, it resists this torsion because annulus fibrosus has collagen. The last is shear. Shear, it occurs parallel to the disc and tend to cause each vertebra to slide on one above. So it will cause translation movement. So this is a brief about kinetics and kinematics of the vertebral column. I know it is a bit difficult to remember, but I will always suggest that remember first the kinematics and then the kinetics. Then it becomes very easier to remember the kinetics and kinematics. And if you know the basics of vertebral column easily, it will become very easy for you to understand biomechanics of vertebral column region wise. So this is it for today's lecture. In next lecture, we'll be starting with the kinetics and kinematics of the cervical, thoracic, lumbar and sacral region. So if you like this video, do like, share and subscribe to my YouTube channel. Bye guys.